Hi, I'm John Pritchard with Venture Medical, and this is a 3080 series operating table from Amsco Steris. And what we're going to do today is we're going to put the urology accessories on it and kind of show you how they fit on there. So first thing you would do on this table is you're going to have the patient reverse oriented. So you're going to have the patient's head on this end and their legs and everything on this end. So you don't want to lower the leg section. You can do that by putting the table in reverse orientation and then hitting head down because that's where the patient will be, or you can just do it in normal. I'll just do it in normal for this scenario. So we're going to do leg down on this. And this is going to give the anesthesiologist the room he needs to, or she needs to get to the patient's head so they can administer anesthesia. So we're going to lower this down. And once that's lowered down, we are going to remove the headrest. So remove the headrest, and what we're going to add is we're going to add an 8-inch urologic extension. This urologic extension is radiolucent, so you can use it with a C-arm for guided procedures. It's very simple to install. You just put it right back in the same holes that the headrest came out of. Make sure you tighten down the wing nuts, very important. You don't want this thing moving around during the procedure. So go ahead and tighten those wing nuts down. Okay, and then normally you'd have a perineal cutout in your pad, but for these purposes we'll just use the regular headrest pad and put that here. Okay. Now what you would do is you would add the urologic tray or catcher at this point. This is a typical hoop style catcher. It would just connect to the side rails here, and you would put a disposable bag in here in the middle, and that would catch the waste fluid. But for this video, we're actually going to install the original OEM Amsco Steris urologic tray that actually pulls out. So in order to install this, all you do is you have these two holes here on the extension, and you have two pegs under here that will fit into these holes, and that will hold the extension in place. Sorry, the Urocatcher in place. So we just it's in here, like so, and it clicks in. It doesn't move, and then we add this. Now, once this is in place, as you can see, you can actually pull it out for when you're doing the procedure, and you can push it back in, and it hides underneath and stays out of the way. So when we're transferring the patient over, we need a transfer board or transfer extension, and the transfer extension actually fits right into the holes of the urologic extension. So what you would do is bring the patient over the stretcher. You would get them on the table, and their legs actually be resting on this for now. Then what you would do is actually put the stirrups on the table. In this urologic procedure, you're going to need stirrups. So you would take your Clark sockets and your stirrups and you put them on the table. So. The same thing on the other side with the patient's right-handed stirrup. Take your Clark socket, put it on the accessory side rail. Okay, rotate it. And then place the stirrup to the side. Tighten that down. Okay. All right. And then you could position the patient with their legs in the stirrups. And then all you would do is loosen the wing nuts underneath, pull the urology extension out, place it safely aside, pull your urologic catch tray out, and you're ready to do a urological procedure. Thanks for watching, and we'll see you on the next video.